town. You guys kind of combining forces like two superheroes in, what do you call the field that you're in?
Well, let's see, incisionless surgery, I guess.
Yes, we're getting
here
involved
to talk about
in
today.
Something called NOTES, which is natural orifice transendoscopic surgery, where people are now operating on individuals through natural orifices, the mouth and other orifices to the ear, but the rectum and so on, to remove appendixes, to do things in the abdominal cavity that we weren't able to do before. And Scott and I are involved in one of these NOTES procedures that's applicable to a large percentage of people.
Well, I know the one thing you guys wanted to come in and talk about is this acid reflux. And it seems like I said to you, I was just during the commercial break, there's commercials for it, there's drugs on TV. It seemed like growing up you'd never even heard of it, not aside from experiencing it, but there just wasn't all this attention given to acid reflux. What are the symptoms? What is it? What causes it? How do you know if you have it?
Well, the primary symptom is heartburn. So that's the first thing that people generally notice. What happens is fluid comes back up from your stomach and goes through the valve at the bottom of the esophagus, the swallowing tube, because that valve weakens over time. And this fluid is not supposed to be in the esophagus. It's not designed to protect itself the way the stomach is. And that fluid has a lot of acid in it, and it's very painful. It causes burning.
So is that the symptom, like a burning sensation in the throat?
Heartburn is the most common sensation. This swallowing tube, the esophagus, propels food contents to the stomach. The valve at the bottom of the esophagus opens to allow food to go in the stomach. Then it closes and is a barrier then to prevent reflux of any materials. As this weakens with time, acid exposure not only causes painful symptoms like heartburn, it causes a globus fullness sensation in the upper airway. It can cause asthma, breathing problems.
Yeah, breathing problems is the part that seems kind of alarming, because you don't think of like having your stomach affect your breathing, but those are some of the symptoms as well, not being able to breathe well.
So at night when you're lying down, a little bit of acid trickling up your esophagus, flowing into your lungs, can burn, inflame your lungs, and cause reactive airway disease or asthma. Also, an alarming symptom is about 40% of people with long-standing heartburn, I'm talking 5 years, and this is not uncommon, have lining cell changes in the lower esophagus that can be precancerous. And when those can be, that precancerous process can be predicted, it can be treated, addressed just by an endoscopic procedure to look to see if that's present. So there's some long-term major complications as well as the short-term discomfort and morbidity associated with that.
So for this procedure that you want to talk about, this procedure, it sounds like you guys, your team, the two of you, are the only ones between Reno and Sacramento that can do this, and you talked about open orifice. Am I saying the word right?
Good. No,
okay,
you said it really well.
But you said you go through the mouth to get to the stomach. Isn't going through the rectum closer?
It's about equidistant actually, but we don't have to go through a lot of other tissue.
Okay. I'm just thinking.
This is a straight shot.
I did a Google map of getting to your stomach, and it seemed like the Google map had me going a shorter distance. But that's not always the best way to go.
We have to go through a lot of different valves.
That's why I'm glad you guys are here.
Yeah, we're just trying to clarify this. Yeah,
much more circuitous.
Okay, that's why the docs are here.
So let me talk about how we've approached heartburn, acid reflux, and I know a lot of your audience has this because it's such a common problem. It's not. It's now just.
This show will give it to you.
It's probably true. You sit on the couch and you eat those things, you know. But we've usually approached this first of all by an evaluation and then by medication therapy. And the common ones are Tums, you hear people taking all the time, or over-the-counter acid suppressive medicines. Some of these are very, very good. However, some of these medications that we use now called proton pump inhibitors, they're medications like Prilosec, Nexium, and so on, although generally safe, are coming up with some concerns with long-term high-dose use. Some people, they don't respond completely. They break through. They have ulceration of their esophagus despite medication therapy. Or asthma occurs, even though you've suppressed the acid. So in those individuals, they have been asked to undergo certain surgical procedures in the past, either an open surgery,
opening the abdomen with the
wrapping,
scalpel and the whole, okay.
And wrapping the upper part of the stomach around the esophagus to produce a barrier.
Much more invasive.
Much more. Then laparoscopic surgery through the belly button evolved to bring about the same sorts of surgical procedures. Now
And you've done these? You've done these procedures?
Scott does those. I'm a gastroenterologist. Scott's a surgeon. Okay, so now there's a natural orifice surgery that combines the skills of gastroenterology and surgery to bring about the same end effect as the old open surgical procedures, but just done through the mouth. And maybe Scott will explain a little bit more about how we do that.
Yeah, so I mean, the guy's sitting out there right now going, this show has given me acid reflux for years. How does this affect, how do I go about taking care of this so I can watch the show all the way through? And
Well, the first thing you want to do is get more information. And our website, bartonhealth.org, has a page devoted to this. It's right there on the screen now, bartonhealth.org/reflux. That'll give you information on how to contact us and get looked at to see how bad your reflux is and whether you're a good candidate for the procedure.
how long does the procedure take?
About an hour.
Quick.
Yeah.
And then in and out, like you get out that same day, you don't have to stay overnight?
Usually we
or-
keep people overnight just to make sure that they're doing okay.
Uh-huh.
And anyway, we do this procedure, and you have to be on a liquid diet for a few weeks afterwards and let everything heal up. But the end result is that you no longer have that fluid coming up from your stomach. And as Dan mentioned, even though we can control the acid level in the stomach with medications and keep you from having heartburn, the other complications of reflux are very prominent. Asthma in particular, you know, I get a lot of patients who have both reflux and asthma, and when you do this procedure on them, we cure both problems. Another one is the long-term use of the medications, as Dan mentioned. That does lead to complications. People who take these PPIs for years and years have a higher risk of pneumonia. It leads to osteoporosis, especially in women.
Wow.
So it's not a totally benign medication either.
Yeah.
So that's one of the reasons we do this, is just to get somebody off their medication.
It kind of strikes me, I mean, all the doctors between Reno and Sacramento, that you guys are the only ones that can do this procedure. Is it because of your skills and background in being a surgeon and your backgrounds in whatever it is you do? I still am not sure what you do, Doc.
Well,
but is it because you guys have gotten together and created a team that has like the perfect balance to actually do this procedure?
Well, Todd, what I do, I'm a gastroenterologist, so
Okay.
I evaluate stomach, intestine, liver disease type of problems. I primarily do procedures within the intestinal tract. Scott is a surgeon, cutting, scalpel,
Yep.
that sort of thing. I've been asked before, when we have innovative things here in Tahoe, why we're doing it and they're not doing it somewhere else. Or
That's my question.
it's too good to be true if it's coming from Tahoe. Well, that's just nonsense. I mean, you can have creative ideas in Tahoe and they can be good ones. This is a relatively new procedure. The long-term data is out 3 years now on this procedure. It's the 2-year data is published, the 3-year data is coming out this next month. The results of that have shown that this approach results in getting off of your medication therapy and having no reflux at 80% after 2 years. 80% of people are symptom-free without medication. That's a pretty good result for any kind of surgical procedure. And Scott and I learned about this. We did our initial training last November, and that was done up in the Seattle area. I think people are waiting to watch this. The surgical societies have all come out and said that this is the most identical approach to reflux as an open or laparoscopic surgical procedure. It's not a gimmick, but it's how people adopt these things and how rapidly they go. So Scott and I have gone very slow. We've done a limited number so far. Our results have been very good. We're trying to select the patients correctly to make sure the best results come for those patients. And we just enjoy doing some new things rather than just staying with the old program. So why we're no different than anyone else. We just are curious, I think.
Well, keep up the good work. That's good. You got acid
Is that
reflux. These are you guys, right? This
Pretty
is
close,
the team to fix it. BartonHealth.org, is that the BartonHealth.org? Yeah, so there you go.
Or you can call the operator at Barton Hospital and ask for Dr. Welker's office or my GI lab, the office at the hospital, and we'll make sure you get all the information and evaluation that you'd like to have.
Well, come back in again. Come back in again,
I
and we'll talk
enjoy
more
coming
Tahoe
back.
stuff. You know, it's kind of more of a serious subject.
It is.
Come back in again, and we'll talk a little bit about more what's going on.
Okay,
Keep
great.
up the good work.
Hey, thanks, Todd.
We'll take a quick break and be back with more of Tahoe Today.